do to actually reduce infection. 1. Make sure you wash your hands. 2. Make sure you get all the vaccines you require. 3. When you're ill, don't spread your infections around to everybody else. And finally, 4. Make sure you take antibiotics appropriately that are prescribed for you and not for anyone else. 1. Hand washing. So why is it important? Imagine everything you touch and then you go and eat something. It's like sucking on every one of these fingers. Everything you touch goes in your mouth. So make sure you wash your hands after going to the toilet, you wash your hands before eating, and you wash your hands when you be somewhere that might have a high risk of infection. 2. Get your vaccinations. Why? Some people are at high risk of infections, and if they get the flu, they can be up to 50 times more likely to die than the normal population. It's also important healthcare professionals get theirs, because 1 in 4 of them will have a mild case of the flu every season, and they can pass it on to the patients they're looking after. 3. Don't spread infections around. If you're ill, don't go to work, don't go to public places and spread your germs around everybody else. If you feel you need to sneeze, don't sneeze into your hands, sneeze into your elbow, be like a vampire. So, 4. Take your antibiotics properly. If you've got an infection, don't ask your GP for antibiotics. He will tell you if you need them. If he does give you antibiotics, take them exactly as instructed. Don't save any leftovers for the next time you feel ill, and certainly don't share them with your friends or family. They probably won't work. Take them to the pharmacy for instructions. So the people who train our doctors, nurses, pharmacists and other healthcare professionals have made a video that everybody has to watch so they understand about antimicrobial resistance and what they can do to prevent it. They've also pulled together in a single place all the other teaching resources to make sure we fight the battle against antimicrobial resistance. The final really important thing is the people who check up on our hospitals, our GP practices and our nursing homes, the Care Quality Commission, are actually checking that everybody has seen the video and they're fully up to date with what they have to do to stop antibiotic resistance spreading further. So what are we doing in Leeds teaching hospitals about preventing resistant infections from spreading? Doing 3 things. So the first thing is about ensuring that all our staff and our visitors are washing their hands when they should do. Secondly, we're making sure that patients who have got infections or are at high risk of infections are isolated in the side room so we can't spread it to other patients. And thirdly, we're trying to make sure that all our antibiotic prescribing is appropriate, so we're not giving anybody antibiotics who doesn't need them. Okay, we need to use antibiotics properly. If we don't, we might actually increase antibiotic resistance. Imagine a world without effective antibiotics. Giving things like chemotherapy for cancer, doing organ transplantation, treating premature babies for infections, all of these will almost be impossible. Without effective antibiotics, all of these people could possibly end up dying and we wouldn't be able to give the treatment that we need. So what's antimicrobial resistance? This is where the bacteria aren't being killed by the antibiotics we want to use against them. Antibiotic resistance can be spread in 2 ways really. Firstly is actually by spreading it from one person to the next by not washing our hands and spreading those resistant bacteria from one person to the next. The second way is actually using antibiotics when we don't need them. And the bacteria are really clever. They don't want to be killed, so they find ways of defending themselves and making the actual antibiotics not kill them. They're clever little beasts, these.